Well, it's a complicated issue, but the bottom line is most of your listeners may not realize how big money going to the hospital system is. About a third of the state budget goes to health care in Louisiana. Number one, we're not a very healthy state. We're always at the bottom of the barrel there because of the huge underclass we have. Poor people aren't getting adequate health care. And so a tremendous amount of money flows towards health needs. Now, a lot of that money comes from the federal government. But you've got to meet certain criteria. And we've seen in the Times-Picayune and in papers all over the state and talked about it on this show how the governor has not taken the Medicaid reimbursement that was part of the Obama plan, quite frankly, health care plan. What it means is that, as been talked about for a long, long time, that we're going to lose the ability to gain about $18 billion over 10 years of federal money. So that's been the controversial issue. A side issue to that is what to do with all the charity hospital systems. We have a number of hospital systems. We refer to them as charity hospital systems in the state. Big Charity in New Orleans that has been moved to private facilities. We've got hospitals in Houma, Shreveport. We've got them in Monroe, Lake Charles, and Lafayette.
So basically all the major cities in Louisiana.
And they were acting as private, rather as public hospitals, but the Jindal administration, in their wisdom, decided to sell all those hospitals, and they've been acquired by private carriers. Now, part of the deal is for those hospitals, they take care of our poorer citizens, and they get reimbursement for it. Well, in a very complicated formula, Jindal, the administration, went to the federal government and said, look, we want to go ahead and have you reimburse us for this care that the federal government gives to indigent defendants. We know we have to make a match for that. We put up so much of the money. But they tried to use some bookkeeping to basically let the feds pay our match. This is not new. Governor Edwards did this back in 1991 and gained a tremendous amount of leverage, and the feds said, wait a minute, we're not going to allow this to happen anymore. Well, the Jindal administration is basically trying to kind of do the same smoke and mirrors, taking the federal funds, using part of those federal funds to pay the state match and say that's all fine because we're doing it through a private system now. And just this week, I think on Thursday of this week, the federal government says, we're not going to do that anymore. Well, thinking it was going to work, Jindal has already transferred these hospitals into private hands, has committed a great sum of money, and the bottom line to your listeners is we're anywhere from $500 million to $800 million short what it's going to take to make all this work. Now, the legislature's in session as we speak. The budget is going to the House of Representatives, the full House, in about 4 days, and all of a sudden, instead of being about $40 million short that they think they can make up, we're talking about a massive hole of as much as $800 million. So it's a huge crisis that Jindal's going to have to deal with. He's going to have to kind of come back home from that presidential run and deal with what I think is the biggest single crisis he'll face during his term as governor.
You know, it's really